Welcome to the deep dive. Today we are plunging into something, well, something that hits home for a lot of us pet parents. Those really persistent, sometimes kind of baffling gut problems our dogs and cats can get. You know the ones, right? They leave you scratching your head, maybe cleaning the carpet.
Yeah.
Again. Anyway, you've brought us a great stack of sources, really insightful stuff, all digging into this condition that's sort of shifted its identity lately, what we often call small intestinal dysbiosis now. So our mission in this deep dive is to cut through that complexity, pull out the key bits from this material, and really help you get what this imbalance is, why it crops up, and what it means for your pet. What really struck me reading these was how our thinking has moved on from those older, maybe simpler ideas. It's not just counting bacteria, is it? It feels like it's about the whole microbial neighborhood getting out of sync.
That's absolutely right. These sources give us a fantastic chance to, really clear things up, shifting from those older terms, which were sometimes a bit vague, to a more nuanced view of the whole gut ecosystem.
Okay, then. Let's unpack this.
Let's get into it.
So first things first, let's nail down the terms. The sources define small intestinal dysbiosis, SID for short, as basically a clinical syndrome. It's caused by an alteration, a change, or an imbalance in the microbes living in the small intestine. And when we say microbiota, that's the whole community, right? Not just bacteria, but viruses, fungi, even these things called archaea. So SID is like the whole microbial neighborhood watch getting messed up, not just one bad actor moving in.
Exactly. And this is where you see how the understanding has, evolved. You'll find older terms in the literature like SIBO, small intestinal bacterial overgrowth. Historically, that diagnosis often hinged on trying to measure bacterial numbers in fluid from the upper small intestine.
Fluid they got how?
Usually via endoscopy. They were looking for counts over a certain threshold, like over 10 to the 4 anaerobic bacteria or maybe 10 to the 5 total bacteria per milliliter of this fluid.
Oh, okay. So they literally tried to count them back then.
Right. But the sources really emphasize that those specific numbers, those criteria, they're now seen as pretty controversial. And honestly, they often didn't line up that well with how sick the animal actually was.
Yeah.
Then you had terms like antibiotic responsive diarrhea, ARD, or sometimes RE for antibiotic responsive enteropathy. That was basically, diarrhea that improved when you gave antibiotics. Didn't really matter why it improved or which bacteria were supposedly involved.
Okay.
And even more specific was tylosin responsive diarrhea, or TRD, which was chronic diarrhea that specifically got better with one particular antibiotic, tylosin.
So say we went from trying to count bugs to just like seeing if drugs helped the diarrhea stop.
Pretty much, yeah. And the really crucial point from these sources is that shifting to the term dysbiosis reflects a much broader and frankly more accurate picture. It's not just about hitting a certain number of bacteria anymore. It's about the balance of different types of microbes, their relative numbers, and even what they're doing, their metabolic activity. And it's super important to distinguish this from, say, an infection with a known bad guy, a pathogen like Salmonella, or certain nasty E. coli strains. Dysbiosis is usually about the normal residents, the commensal bacteria getting out of whack, or maybe being in the wrong part of the gut in too high numbers.
That makes a lot more sense. Less like an invasion, more like the friendly neighbors starting a ruckus because the neighborhood rule broke down. Which brings us right to the next big question.
Yeah.
Why does this imbalance happen? What causes those rules, those systems to fail?
Well, what's really fascinating here, and this is a key takeaway, is that SID usually isn't something a pet just gets on its own. It's almost always secondary to something else going wrong.
Ah, the check engine light analogy. I like that one.
Exactly. The dysbiosis is the warning light, but you've got to look under the hood to find the real problem that switched it on.
Okay, so what's under the hood?
Yeah.
What makes the gut's defenses stumble? Because the gut does have defenses, doesn't it?
Oh, absolutely. The sources lay out several protective layers. You've got the really strong acid in the stomach, kills off a lot of ingested bacteria right away. Then there's gut motility, that constant sweeping motion, peristalsis that keeps everything moving along. It stops bacteria from just hanging around and setting up shop where they shouldn't be.
Keep things flowing.
Right. Plus, you have antimicrobial stuff secreted in bile and pancreatic juice. And local immune defenses right there in the gut lining, like special antibodies called IgA. There's even a physical gatekeeper, the ileocholic valve, kind of a one-way door between the small and large intestine. It stops the huge bacterial population from the colon backing up into the small intestine where numbers should be much lower. So dysbiosis happens when one or more of these defenses fail. And when that happens, it lets certain bacteria, often the anaerobes like Bacteroides and Clostridium, the ones that don't need much oxygen, really take hold and multiply in the upper small intestine where they cause problems.
Got it. Defenses down.
Yeah.
Wrong crowd multiplies. So what specific things can actually cause those defenses to fail? What
Yeah.
did the sources list?
Well, they mentioned several triggers, actual physical problems with the gut structure, like blockages or narrowed areas called strictures, or even outpouchings, diverticula. Slowed gut movement, motility is another big one that can be linked to things like hypothyroidism or even nerve problems sometimes.
And a really major underlying cause they highlighted is exocrine pancreatic insufficiency EPI. That's where the pancreas just doesn't make enough digestive enzymes.
Right, and the link there is pretty strong. The sources mention something like 70% of dogs with EPI also have SID. It makes sense, really.
Why is that?
Well, without those enzymes, food doesn't get digested properly. So you have all this undigested food reaching the small intestine, and it's basically a buffet for bacteria. It lets them overgrow and throw the whole community out of balance. And yeah, German Shepherds definitely get mentioned as being prone to EPI.
Ah, okay. So undigested food literally fuels the fire.
Mm-hmm.
What else can knock down those defenses?
Reduced stomach acid is another factor. Sometimes that just happens, but other times, maybe ironically, it can be caused by medications we give, like those common acid-suppressing drugs, the proton pump inhibitors. If the stomach isn't acidic enough, that first bacterial killing step is weakened. And then you have issues with the immune system itself, or if there's already an underlying intestinal disease. Think inflammatory bowel disease, IBD, or even bad reactions to food. These conditions disrupt the local gut environment and defenses, making the pet more susceptible to developing dysbiosis.
It really does sound like it's often a symptom, not the root illness. Did the sources mention specific breeds being more prone beyond the EPI link in shepherds?
Yeah, they did mention, though maybe more subjectively, German Shepherds again, Chinese Sharpies, and Beagles as possibly having a predisposition to small intestinal dysbiosis. And interestingly, they noted boxers have a known genetic link to a type of dysbiosis specifically affecting the large intestine, sometimes called histiocytic ulcerative colitis, or HUC. Now, that's different from SID, but it does show that genetics can definitely play a part in these gut microbe imbalances.
Wow. Okay, so it feels like almost anything that upsets the normal gut function, whether it's upstream or downstream, can potentially lead to this imbalance.
Right.
So if a pet does develop SID, what does that look like? What are the actual signs we might see? What's that check engine light manifesting as?
Well, the signs are often, frustratingly common to lots of different gut problems, which is partly why figuring it out can be tricky. The absolute hallmark sign is usually chronic loose stools or diarrhea, and chronic usually means it's been happening for more than, say, 3 weeks. The type of diarrhea can vary too. Sometimes it's that classic small bowel type large volume, maybe less frequent, but other times it can actually look more like large bowel diarrhea.
And the sources really pointed out weight loss, didn't they? That seems key.
Yes, weight loss is common, and here's the really telling part. It often happens even if the pet seems to have a normal appetite, or sometimes even eats more than usual.
Why is that?
It's down to malabsorption. The dysbiosis messes with how nutrients are absorbed, so even if they're eating plenty, they're just not getting the goodness from their food.
You might also notice really loud gut sounds. The technical term is borborygmus, and more gas, more flatulence. Vomiting can occur, but it tends to be a bit more variable, less consistent than the diarrhea and weight loss.
And the signs can definitely come and go. They might wax and wane, or they could just be persistent, continuous.
So intermittent or constant trouble. And when the vet actually examines the pet,
Often the physical exam might be pretty unremarkable, honestly. Maybe just clear signs of that weight loss, poor body condition score.
okay, so we've got these kind of vague, long-term signs. It's often secondary to something else. The vet might not look too bad on a basic exam. This really begs the question, how in the world do vets actually diagnose this? It sounds like putting together a puzzle.
It absolutely is a puzzle. The sources are very clear. Diagnosing SID is challenging. There isn't one single perfect test for it. So it often becomes what we call a diagnosis of exclusion.
Meaning you rule everything else out first.
Exactly. You have to systematically rule out all the other potential causes for those signs. That means checking for big systemic diseases, kidney problems, liver issues, pancreatitis, maybe hormonal things like Addison's disease. You definitely look for infections, especially parasites. Standard blood tests and urine tests are usually done. They might not point directly to SID, but they can flag those other underlying diseases or maybe hint at how severe the gut problem is, like if protein levels, albumin, are really low.
An imaging, like x-rays or ultrasound.
Imaging isn't really for diagnosing the dysbiosis itself, but it's crucial for looking for those underlying causes. Anatomical issues, blockages, tumors, other organ problems.
Right, always hunting for the root cause.
Yeah.
What about specific gut tests? The sources mentioned those blood tests, B12 and folate.
Yes, checking serum cobalamin, that's vitamin B12 and folate levels, is pretty common. There's a pattern that can be suggestive of SID, although, and this is important, it's not definitive or specific just for SID.
What's the pattern?
The pattern is typically low cobalamin and high folate.
And why would that happen?
Well, the thinking is the bacteria hanging out in the upper small intestine can actually produce folate, potentially leading to increased absorption and higher levels in the blood. On the flip side, many of those same bacteria use up cobalamin, basically competing with the pet for it. Plus, cobalamin absorption mainly happens further down in the small intestine, in the ileum, which might be damaged or not working well, so you can end up with this low B12 high folate picture.
But it's not always seen.
No, definitely not all pets with SID show this pattern. And low cobalamin is incredibly common in almost any chronic gut disease, including EPI. So it's suggestive, helpful information, but not a standalone diagnosis. The sources do note, though, that the B12 folate test is one of the few gut-specific blood tests readily available to most vets.
Okay, so suggestive, useful, but not a slam dunk. What about actually testing the bacteria directly? Did we move past that entirely?
Well, historically, like we mentioned, the gold standard for the old SIBO diagnosis was trying to culture bacteria from duodenal juice collected during endoscopy. You'd literally get a fluid sample via a scope and try to grow and count the bacteria in the lab.
Which sounds invasive.
It is. And the sources really detail why it's largely fallen out of favor for routine diagnosis. It's invasive, needs special equipment. The results were often quite variable depending on how and where you sampled. It's really hard to properly culture many of the important anaerobic bacteria. And maybe most importantly, those criteria based purely on bacterial numbers just didn't hold up that well. We now know it's much more about the balance and the types of microbes, not just hitting some magic number.
So if counting isn't the way, what's considered the best approach now, according to these sources?
Some sources point to the fecal dysbiosis index, using qPCR as being sort of the current best practice or emerging gold standard.
Okay, fecal dysbiosis index. So you test the poop and qPCR. What's that exactly?
Yep, it's a non-invasive test using a stool sample. qPCR stands for quantitative polymerase chain reaction. It's a fancy lab technique that lets you measure the amount of DNA from specific bacterial groups in that sample. The test looks at the relative abundance of various key bacteria, some good, some potentially problematic, and calculates an overall dysbiosis index score. This score gives an indication of whether the bacterial community in the stool looks balanced, or if it looks out of whack, suggestive of dysbiosis.
Okay, that sounds promising. Non-invasive is good. Are there limitations?
The main limitation the sources mention is that, well, feces mostly reflect what's going on in the large intestine, the colon.
Ah, right. Not the small intestine directly.
Correct. But gut health is all connected. Often, significant changes in the large intestine's microbiome can mirror or be influenced by problems further up in the small intestine. So the fecal dysbiosis index can still be a really useful, though indirect, tool for assessing overall gut dysbiosis, including the kind that contributes to small intestinal signs.
So let me get this straight. We went from invasive scoping and counting bacteria, which wasn't ideal, to indirect blood markers like B12 folate, which are only suggestive, to now analyzing bacterial DNA in poop, which is easier but mainly looks at the colon. It sounds like we still don't have one perfect test specifically for small intestinal dysbiosis.
That's a fair summary, yes, which is precisely why the therapeutic trial remains so important and is frequently used in practice. The sources explain that often the diagnosis, particularly for the antibiotic-responsive form of SID, is made retrospectively.
Meaning you figure it out after the fact.
Exactly. You treat the pet with an antibiotic that's known to often help SID, like tylosin or metronidazole. If the pet shows a dramatic, positive clinical response, the diarrhea resolves, they feel better. Then you tentatively conclude that antibiotic-responsive dysbiosis was indeed the issue.
Oh, okay. Diagnosis by response to treatment.
Yes. But, as the sources caution, interpreting these trials needs care. It can be tricky if the pet has multiple health problems going on at once, or maybe if the antibiotic chosen wasn't quite right or wasn't given for long enough. And if the signs are really severe or just don't improve with these initial steps, that's when vets will typically recommend pushing further with more advanced diagnostics. Things like a detailed abdominal ultrasound or even endoscopy with biopsies to really look for those underlying causes like IBD, physical abnormalities, or even, unfortunately, something like cancer.
It really is a step-by-step layered approach then. Okay, let's shift to the good news management and treatment. If a pet is diagnosed with or strongly suspected of having SID, how do we help them? What's the plan?
The absolute number one most crucial principle, which is hammered home in these sources, is treat the underlying disease. You absolutely have to address the root cause. If you don't fix what triggered the dysbiosis in the first place, it's just likely to keep coming back.
So if it's EPI, you give the pancreatic enzymes. If it's IBD, you manage the IBD. Makes sense.
Precisely. Giving enzymes for EPI, controlling inflammation in IBD, surgically correcting an anatomical problem if possible, tackling that primary issue is paramount. And often, successfully managing the underlying condition will actually resolve the dysbiosis without needing specific long-term treatment just for the imbalance itself.
What about food? Does diet play a big part?
Oh, a huge part. Dietary modification is key. The sources strongly recommend using a highly digestible diet.
Why highly digestible?
The rationale is that these diets are broken down and absorbed more easily and efficiently higher up in the digestive tract. This means there's less undigested food material reaching further down the small intestine to essentially act as fuel for those problematic bacteria. Less fuel, less overgrowth. If there's a suspicion that food sensitivities or allergies are contributing to gut inflammation and triggering the dysbiosis, then novel protein diets or hydrolyzed diets are often the way to go.
What about fiber?
High fiber diets get mentioned. Sometimes they can be beneficial, but the sources generally advise using them cautiously. In some cases of small intestinal disease, extra fiber can actually make things like gas and diarrhea worse, so it's not a first-line approach for SID usually.
Okay. And for that specific antibiotic responsive type, ARE, then antibiotics come into play. But you said use them carefully.
Yes, exactly. For cases where antibiotic-responsive enteropathy is confirmed or highly suspected based on ruling other things out or a previous positive trial, then broad-spectrum antibiotics are often the treatment of choice, ones that are effective against both aerobic and anaerobic bacteria. But yes, carefully is the operative word.
Which antibiotics typically get mentioned in the sources?
Tylosin is highlighted quite a bit, often as a primary choice in some situations. The usual dose is around 10 to 20 milligrams per kilogram, given by mouth twice a day. Treatment duration is typically about 6 weeks, though sometimes it needs to be longer. It usually comes as a powder, often marketed for larger animals, so it needs to be reformulated or carefully dosed for pets and mixed into food because apparently it tastes pretty bitter. But the upsides noted are that it's considered very safe, it's relatively inexpensive, and it might even have some beneficial effects beyond just killing bacteria, potentially some immunomodulatory effects.
Okay. And metronidazole, that's another common one you hear about.
Yes, metronidazole is definitely another frequent choice. Dosing is usually around 10 to 15 milligrams per kilogram, again, typically twice a day. It's particularly good against anaerobic bacteria and, like tylosin, is also thought to maybe have some immune modulating effects. However, the sources are quite clear in urging caution with metronidazole. There is a known risk of potential side effects, which can sometimes be significant, including, rarely, neurological problems. And perhaps more fundamentally, there's a growing concern that long-term or repeated courses of broad-spectrum antibiotics, including metronidazole, could actually cause or worsen dysbiosis over time by wiping out beneficial bacteria along with the problematic ones, further disrupting the gut microbiome balance.
That's a really critical point. So the idea is use them when you really need them, usually for that defined course, maybe 4 to 6 weeks, perhaps taper off. But the goal is definitely to avoid keeping them on antibiotics indefinitely, if you can possibly help it.
That's exactly the goal. You want to knock down the acute imbalance, but ideally manage the underlying condition well enough so that continuous antibiotics aren't necessary. And to help restore a healthier gut environment, especially after a course of antibiotics, things like probiotics, prebiotics, and symbiotics are often recommended.
Can you just remind us quickly of the difference?
Sure. Probiotics are live, beneficial microorganisms, the good bacteria themselves. Prebiotics are essentially food for those good bacteria. They're usually types of non-digestible fiber or compounds that selectively encourage the growth of beneficial species already in the gut. And symbiotics are just products that contain both probiotics and prebiotics together.
Did the sources say anything about choosing these?
Yes, they do emphasize the importance of picking products from reputable manufacturers. There have been studies showing significant variability in the quality and viability of bacteria in some over-the-counter probiotic supplements, so choosing a trusted brand is important. And specific prebiotics like fructooligosaccharides FOS are mentioned as having shown benefits in studies with dogs that had SID.
Okay. And you mentioned B12 before.
Right. Critically important. If those cobalamin B12 levels were low on testing, supplementation is absolutely vital. B12 deficiency itself can actually impair gut cell function and make the whole gut disease worse. It's a bit of a vicious cycle. The standard approach, according to the sources, is usually to start with B12 injections, just to bypass any potential absorption issues in the damaged gut. Once the gut health starts improving, you might then be able to switch to an oral supplement.
Makes total sense. Fix the deficiency that could be making the problem worse. Is there anything else?
Yeah.
Maybe for really tough, stubborn cases.
Yeah, fecal microbiota transplantation, or FMT, gets discussed. It's considered more of an emerging therapy, especially in dogs, for those really refractory cases of SID that just aren't responding well to the standard treatments.
The idea there is,
The idea is basically to completely repopulate the sick pet's gut with a healthy, diverse microbial community from a rigorously screened, healthy donor animal. It's usually done by introducing a slurry of donor feces, either rectally via enema or sometimes orally in capsules. It's still evolving, but it holds promise for sort of rebooting the microbiome in difficult situations.
wow, quite a range of tools then. From hitting the root cause, hard to diet, careful medication use when needed, and actively trying to support and rebuild that microbial community. So what's the bottom line for a pet diagnosed with SID? What's the general outlook, the prognosis, according to the sources?
Well, as you might guess by now, it really hinges heavily on that underlying cause.
Always back to the underlying cause.
Always. So if the root cause is something identifiable and manageable, like EPI, where you can give lifelong enzyme supplements, or maybe the dysbiosis was triggered by a drug that can be stopped, then the prognosis is generally good, even excellent. The dysbiosis should resolve once the trigger is managed. Now, for that idiopathic antibiotic responsive form, the ARD or ARE, where you seem to need long-term or maybe intermittent pulses of antibiotics to keep the signs controlled, the prognosis is often more guarded.
Why guarded?
Because relapses are really common whenever you try to stop the antibiotics. And as we discussed, there are those ongoing worries about the long-term impact of repeated antibiotic use, including the potential for developing antimicrobial resistance, which is a huge concern in both veterinary and human medicine.
And what if the dysbiosis is just a symptom of something really serious and hard to treat, like severe advanced IBD or, sadly, some kind of gut cancer?
Yeah, in those tough situations where the primary disease itself carries a poor prognosis, then unfortunately the prognosis specifically for resolving the SID is also going to be fair to poor. You're unlikely to fix the microbial imbalance if you can't control the underlying disease driving it. Monitoring progress usually involves watching for resolution of the clinical signs, mainly the diarrhea stopping and the pet gaining weight, looking for improvement in their overall body condition, and sometimes rechecking those B12 and folate levels, or maybe even repeating the fecal dysbiosis index to see if the microbiome profile is shifting back towards normal.
Okay, so putting this all together, what's the big picture takeaway for you, the listener, who might be navigating these chronic gut issues with your pet? It seems small intestinal dysbiosis is this really complex microbial imbalance. Crucially, it's usually not the primary disease itself, but more often a downstream consequence, that check engine light signaling something else is wrong. Figuring out is definitely a puzzle. It relies on meticulous detective work, ruling out other diseases, looking for those suggestive clues like the B12 folate pattern, maybe using newer tools like the fecal dysbiosis index, and sometimes seeing how the pet responds to a treatment trial, particularly with antibiotics. And treatment isn't just one thing. The absolute cornerstone is tackling that root cause, whatever it may be. Then supporting the gut through highly digestible diets is key. Antibiotics have a specific role for certain forms, but need to be used thoughtfully because of potential downsides. And actively supporting the good microbes with things like prebiotics, probiotics, and fixing deficiencies like B12 is also super important. Hopefully, understanding this complexity helps you have more informed conversations with your vet. It helps appreciate why diagnosing and managing these chronic gut problems can sometimes involve a really thorough investigation, take a bit of time, and often require this kind of multi-pronged strategy that's tailored specifically to your pet and what's actually driving their issues. It's really not just about stopping the diarrhea, is it? It's about trying to restore balance to this incredibly vital system. And maybe just a final thought to leave you with. These sources we looked at really drive home just how incredibly sophisticated and complex the gut microbiome is. This whole bustling metropolis of bacteria, viruses, fungi, archaea, all interacting inside your gut. And given how fundamental gut health is for overall health, influencing immunity, maybe even mood and behavior, definitely not just digestion. It really makes you wonder, doesn't it? As we keep learning more about these intricate microbial communities in our dogs and cats, what other surprising connections to different diseases might we uncover? And what kind of innovative, maybe microbiome-focused ways to support their health might emerge down the road, ways we can barely even imagine right now? It truly feels like a whole new frontier of medicine right there inside their bellies.